doctors, pharmacists, all healthcare professionals.
Doctor has to be the prime influencer. If the doctor is not buying it,
so clinical decision making becomes easier. With the past medical records being
move on to one of the most interesting topics in pharma today.
Is the commercial director at Servier India. He brings over 25 years of expertise in leadership, team management, and driving change. Formerly head of marketing for cardio-metabolic care and endocrinology at Merck Group, he excels in strategic communication and leading high-performance teams in the healthcare industry. Mr. Salil Kallianpur, as already introduced earlier today, is a marketing strategy and digital transformation advisor with extensive pharmaceutical experience. Mr. Anish Mitra specializes in developing innovative data-based healthcare solutions. With an experience in Abbott and Credit Suisse, he is an alum of ISB Hyderabad, Exeter, and Christ University. Mr. Mitra is also a pianist, a scuba diver, and the curator of TEDx Dharavi. Ms. Zena D'Souza, with senior roles at Sun Pharma, Glenmark, Ipca, and Emcure, is a seasoned expert in pharma marketing and brand building. As a consultant, she drives impactful campaigns and innovative strategies for top pharmaceutical companies. Thank you, everyone, for gracing us today. With this, it's time to set the pace and dive deep into an exciting discussion on digital transformation. So over to you, our moderator, Zena D'Souza, ma'am. Thank you.
Vaishnavi, for those wonderful words of introduction. All of us feel very happy when they hear you talk. So, good evening, everyone. And thanks a lot, Team Scope, Team Pharma State Academy. You've really managed to scope out discussions which, for want of a better word, I will call them hot. The speakers have truly sparkled today. I have been sitting there in the audience from morning and I've heard almost all of them speak. The discussions have been sizzling. And I'm sure the last panel will also not disappoint you. So having given my thank yous, I will now move on to one of the most interesting topics in pharma today. Digital health, digital therapeutics remains a very interesting topic. So, if Mr. Oscar, George, and Mr. Viju really manage to shake off that post-lunch somnolence, I assure you that the next 30-35 minutes will manage to keep you in a state of, wakefulness and interest. I have three very experienced and very enthusiastic panelists with me, so I will not take a lot of time. I will directly delve into the topic with a set of questions for each of them. For proprietary, I will address one of you, but any of you can feel free to chip in. Okay. I will not start with the person whose name is synonymous with the word digital. Salil sir, I mean you. My first question to you is, in what ways can digital health tools contribute to preventive health measures, particularly in diseases with high lifestyle-related risk factors?
So, I think it is important to understand this from a first principles point of view. Okay, what is actually happening with the influx of technology into the sector? Or even before the sector, what is happening with the influx of technology? With the influx of technology, we have got access to information like never before. And when I say we, it means anyone. Okay, so earlier medical information used to be the domain of doctors, pharmacists, all healthcare professionals, and only them. And the common man had no access to that information. Today he has access to that information. And he can access that, he or she can access that information at the press of a button. It is device agnostic. It can be accessed from anywhere as long as you are connected to the internet, which is again ubiquitous. You get it. Now what that does is that it has opened up, or consumer behavior has become such a way. Like I think Dr. Bang said it in the morning, that patients are no longer patients, they're consumers now. And so when they become consumers, they want to participate. They're not going to be passive in the transaction. And so when they are involved in the transaction, they want to be participative. Okay? And so when they are participative, they give out a lot of data. There's a lot of data that is coming through on all the interactions that happen on digital assets. And when data comes in, it makes healthcare predictive. Because you can analyze the data, you can kind of look ahead, you can look to think about how to prevent disease rather than wait for that disease to happen and then, take care of it. So I think there, digital therapeutics has a huge role to play. Then comes the point of preventive. When I can predict that something is going to happen, I give you out advice or suggestions or nudges on what to do so that your health doesn't go from bad to worse. And so the whole app ecosystem that we're seeing over there, the Healthify Me and so on and so forth, the Twin Healths and the Fitterflies and all of that is actually a rise over there. And so at the end, all of this is interesting to me because the advice is for me, it is personalized. And so the 4 Ps of healthcare have moved drastically. Earlier there were no Ps. There was only the doctor. And so now the 4 Ps that have come in is about how healthcare has become participative, how it has become predictive, how it has become personalized, and how it has become preventive. So I think from that perspective, if you understand that perspective, you understand why you need the digital therapeutics, what is the role of an app, or what is the whole point of having that whole ecosystem of, or a platform of service providers catering to that one sick person. So many years ago, I read a book which Gary Hamel had written called The New Age of Innovation. And of course, C.K. Prahalad and Gary Hamel had written that. And there was a nice equation, which I quote on many occasions. So, N is equal to 1, R is equal to G. This is something he wrote in 92, okay, when we didn't even hear about the word digital. And so what he meant by that is that going forward, the new age of innovation, the customer is going to be personalized, one person. And companies will harness their global resources to serve that one customer. This is exactly what is happening in this world of digital apps and digital therapeutics. So I couldn't simplify it more.
Great. I think that's true because whenever I have interacted with doctors, I realize that over a period of time, it is not something like doctors will say and I will do as a patient. I think the patient has evolved. The doctors have also evolved, obviously, but the patient has evolved to a larger extent as compared to where the patient was 20 years back. And today, he or she wants to be an active participant in the therapy. So it's not like, earlier there was the saying कि यार Dr. Bhagwan है, he's God. वो बोलेंगे और मैं करूँगी. And now it is more like, you need to explain to me the logic of what you're writing, why you're writing, and what suggestions you're giving. And like you said, healthcare or digital healthcare could really make it very customized, very personal for me. And as a patient, I would feel very cherished, thinking that, okay, the doctor really cares for me. And, I'm not just part of a statistics of, 100 people who have the same disorder as mine. Great. Thank you. I will address Anish now. Anish, how can digital health technologies aid in the early detection and management of disease outbreaks?
Thank you for the question and a good evening to each one of you. And thank you, Pharma State Academy, for inviting me. Sorry for looking a little haggard. The rituals are going on. My grandmom passed away about 8-9 days back. And also I have 2 young daughters keeping me awake every day. So to addressing the question, I think if I first operationalize what is digital health, it would be digital platforms. It can be device-based, which can be laptop, desktop, or a mobile, and also wearables. Now, these facilitate something which was never done before in an easy manner, and that is data collection. So once we have data, you can apply human or AI/ML to do the analytics, the prescriptive and the predictive analytics, to personalize healthcare solutions for the patients. And now, against this concept, I'll give 3 examples. One is from the US, one is closer to home from India, and the third one is also from India. This same concept can apply to a patient before a clinic consultation, during a clinic consultation, and after a clinic consultation, during the entire continuum of healthcare delivery. And I'll share some examples which I've been closely associated with throughout my career and some learnings from it. So the first is from the US, wherein we are talking about the CGM, the continuous glucose monitoring devices of Abbott and Dexcom, which is far state-of-the-art now. And they are trying to address and target the pre-diabetes patients, not patients with diabetes, the pre-diabetes patients who don't even have anything. And they are putting that device. But what is happening now is the analytics is still not so evolved, because so far the analytics was done with diabetes patients. So the data, the AI/ML has been run on diabetes patients. And for the pre-diabetes patients, they are getting constant nudges. They are stressing over it. after having one ice cream, if my calorie goes up, I'm overstressing that I have diabetes, and they're going to the doctor, and the doctor is saying, no, you are fine, do not worry. So there is this little bit of conflict as the evolution is happening from the CGM data, the CGM devices in the pre-diabetes space. However, we are all sure that during this course of this evolution, as more and more data is captured and the AI/ML application improves, there would be better sensitization and guidance in terms of the nudges. Coming closer to home, we are talking about the EMR software, which doctors are using at a slow but a steady pace in terms of adoption. How can this help doctors detect diseases early? Because the past medical records are available with the doctors at the time of a consultation. So clinical decision making becomes easier. With the past medical records being digitized, AI algorithms can also be run to automate and suggest to the doctors, based on that doctor's prescription habit as well as all the other doctors of that segment, that this patient has a high chance of having also B or C comorbidity. So this is early detection in a clinic for other diseases not yet diagnosed. And there is some work going on over here. We are trying to solve for it. It's very exciting. But there's a journey to go over here, because we are still at the adoption stage of doctors just using EMR software. And the third is, recently had the opportunity to work with one of India's leading patient support programs. This is post-consultation care, which is being extended out to the patient for a certain chronic disease. I'll not disclose the name of the company, but I got to participate in the entire journey. We're trying to work out something. And here, in what I understood is, essentially it's an app. It's a mobile-based app to help in improving the compliance of a patient. And what is the basic compliance requirement of any patient in chronic disease? Dawai khao, time pe. Simple. Now, in the journey of digitalization, the app says and was doing hundreds of things. But who are the patients who are coming? They're coming from simple, most of them are coming from simple backgrounds with a smartphone. Number one is going to an app store and downloading it, and number one is also flooding them with so much information. I just need, as number one, to have my medicine on time. And what is the easier way to communicate that? Through WhatsApp. So now there is some evolution in the patient support program to simplify that bit. However, having said this, the same patient support program has multiple other facets which have been successful for 30 years in this space, but they're also improving here. So the lessons which come across these three applications of digital solutions are, somewhere we are dealing with the lives of patient. So we should not forget, in the art or quest of digitizing using technology, we treat them as units. We have to bring in the human element and keep things simple. And the second point would be also to integrate across the ecosystem. Apps by a celebrity recommendation for a diabetes app would not work versus how powerful it can be when the doctor prescribes a digital app. So these are some of the learnings I think we would be all jointly trying to solve for in India.
Well said, Anish. And just one line that I would like to, echo or rather differ. You said that adherence to medicines, it's as simple as that. Believe me, it's the most complicated thing. I have been a very bad patient myself, and I've seen all family members. So when it comes to others, I'm very good at giving advice. Nahi, you have to say as the doctor takes, but believe me, it doesn't happen. It is easier said than done. And simple adherence, I think if any digital app could manage that, that would be a game changer for patients, for doctors, for the pharma industry, for everybody in the ecosystem. Anyways, continuing with my series of questions, Mr. Velmurugan, you're next. How are digital therapeutics changing the landscape of chronic disease management? And what are some of the most promising applications you've seen in this space?
Thank you, Zina. First of all, I think the point which you made just before is extremely important, that it's not as simple that somebody takes a pill because the doctor is asking them to take it. It's not happening, because I would like to quote a very important data point here. First, to understand that adherence, a proper adherence study has proven that adherence improvement can reduce mortality up to 40%. And this is not a latest evidence. It's almost 2006 BMJ, which means that is the significance of adherence. So adherence cannot be understated, because we always believe that control rates are dismally low in our country, and it's the same everywhere in the world. But what is the reason for poor control? It is adherence. People are not adherent to the treatment. And we believe that it is very easy, and the doctor says, and the patient consumes. So coming to the question, Zina, I think it is important for us to understand that digital is revolutionizing how the healthcare is moving forward. And Salil made a very interesting point regarding how personalization is going to be very important. And the patients are becoming more and more aware. We call them Google. They go to Dr. Google. Most doctors say that, did you consult Dr. Google before coming to me? So that way the patients are very well informed and they know what they are doing, and sometimes they do something which they are not supposed to do as well. And somebody said that we will help the pharmacy guy to ensure that he gives the right medication. So by improving the knowledge or awareness about those people. But it is important for us to understand that this digital healthscape, the health therapeutic which you are talking about, is going to improve the way how the patients are taking the right decisions when it comes to their own health. They're not just following some Google platform. There are enough applications. I think I don't have a single answer for that question on which are all the promising applications. There are plenty actually in India. We just looked at almost 120 diabetes applications alone, and all of them are good. But depends upon how it is used. Is it really making a difference for the patient? For me, the patient will use it if the doctor tells the patient to do so. That is important. That landscape is there. I am very happy with what Oscar showed just before in the earlier session, that you see India is similar to the rest of the world as far as the digital applications, AI. We are more or less there. But we have other challenges to face in India. But here, the important thing for us to understand is, do not misinterpret what is coming. When it is digital applications, the patient needs to know what he has to use, and the doctor has to be the prime influencer. If the doctor is not buying it, the patient is not going to use it, and the application, whatever is there, is not going to be of any help because the usage is dismally low. I was just talking to Salil just before the session. So many applications, how many of them are using it? One-time user, one-time downloads, one-time usage. Beyond that, what after that? So is the HCP part of your ecosystem to drive this change? That's the question we have to ask. Thanks, Zina.
Great. I will complete that question. There's another part which I will ask Mr. Salil. So I've asked you about the chronic disease part, and for you, Mr. Salil, I'll complete the spectrum by asking you, while digital health often focuses on chronic diseases, what role can it play in improving acute care management, such as post-surgery recovery or acute infections, etc.?
Yeah, so pain management, all these are basically the acute parts of the market or illnesses. And over there, I think one important distinction is that app makers make the app for the patient. I can't think of a guy who broke his hand actually wanting to open an app and find out what to do. Right? So it's basically not meant for the patient. The target audience is different. It's the caregiver or the doctor or something like that. So there are roles for these digital therapeutics to play there. For example, what do you do in post-surgery recovery, right? So there are nudges. Obviously, it's not the patient. It's not meant for the patients, mostly for the caregiver. So that's, I think, the basic difference between acute and chronic. And we helped an organization in India build one such app-enabled reach out to patients who are lost to follow-up in the cancer area. And so this was like stage 4 cancer when people move into palliative care and the doctor says there's nothing we can do and take them back home. And they're there. And the system is that the caregiver is in a state of panic because the doctor is not in touch. There's no hospice. There's no hospital environment there. The patient is at home. The patient is probably comatose, not in the right frame of mind. There are several such issues. So there's so many information points that can be given to that person. For example, chemotherapy or radiation actually heats your scalp a lot. So a scalp cooler is something that no doctor will tell you that. Or the fact that there is specific or different linen that is used for treating people with bed sores. For example, people who are bedridden or post-surgery or something, anyone who's got bed sores, even terminally ill patients. And so there are certain nudges that can happen using digital over there. And so this organization did that very well. And obviously it is not the lifetime of the patient, but the lifetime of that family. Because the good work that is done over there, kind of gives equity for that hospital, and so then everybody kind of comes there, or they're happy with the way that. So there's any touch that is happening, because people are in need for information. They don't know what to do, and so apps that lead to communities. Patients like me, I want to know what to do. I'm taking care of somebody who is. Who either had a fracture or a surgery or is terminally ill or any of these categories. I don't know what to do. Where can I get that information? I can't keep calling the doctor. The doctor is going to be annoyed. And so eventually I don't have patient counselors. I do not have health concierges. I don't have any. These jobs don't exist in India. And so that's a very clear role for digital therapeutics and digital apps to play.
Great. You mentioned a very important person in this whole spectrum, and that's the caregiver. Sometimes we tend to look at the patient so much that we forget that there are times or there are cases where the patient is not able to take a decision, not in a position to take any kind of decision. And it's the caregiver who's actually taking care of the patient, and it is he or she who's managing everything, right from, adherence to medicine to the do's and don'ts to, whatever. So they also need help when it comes to these kind of problems. Great. I will circle back to you, Anish. How do digital health solutions address the healthcare gap between rural and urban population? And could there be some digital health tools which could be customized to address this diverse need?
Thank you. So this question I've been discussing with multiple people from the healthcare industry, some pharma investors, some pharma folks who are in strategy. And the main problem of India's rural, I think Oscar's presentation, that quadrant, the top right hand, the first point was tier 2, which is very different from the rest of the world. What is the problem that we have here? Accessibility of good healthcare professionals if you go down to the sub-centers where the ASHA workers are there. And there are literally 4 levels from a sub-center to a primary center to a district center. There are 4 levels until you come to a district level hospital where you don't have specialists in those 3 levels. And for someone from that sub-center to reach a hospital is about 100 kilometers, a day's worth of salary, because they're all daily wage earners. So it's a big problem. So accessibility is not there. Number 2 also of what? Good quality medical professionals, good quality medical solutions. And wearables are a far-fetched thing right now. Digital therapeutics is not happening there right now. Let urban India take that up, the way it's happening in the US, and then that will go. But if we are talking of digital health solutions, we need to solve for accessibility. And there is one case study. After having scanned over the last 2-3 years on this same topic, I think we know about it also, and it's none other than the Tata Group one, the Digital Nerve Information Center. So what they have done, they have basically integrated these 4 layers of healthcare up to the sub-center, and they have integrated the data in simple EMR. And they have deployed some semi-skilled workers, and they did a pilot in a village in a district in Karnataka. What this does is, for simple pregnancy trimester, first trimester patients, are they on the right nutrition which has been recommended to them? The ASHA workers are skilled enough to follow up with them in that sub-center and also dial that into the app. And that information flows back across the primary, the community, and the district health center. And there is a nudge from the specialist sitting in the DNIC in case something is going off, which the ASHA worker is skilled enough to go and communicate to the patient with that in the physical means. If there's a complication, an appointment booking is done for the patient to the 100-kilometer away hospital, district hospital, so the patient can go and actually get an appointment with a doctor. Just booking a simple appointment with a specialist 100 kilometers away is a big thing. It's a day's worth of salary, and so many times they go, the doctor is not available or something like that happens, and they go back and they don't even solve their health, even that income stream from that day goes away. So this simple thing which is being done by Tata on behalf of the Indian government as a pilot, and I think Bill and Melinda Gates has picked it up in Northeast India now, can definitely be a starting point for others to pick up. And who are the biggest stakeholders in India who can do this in the healthcare ecosystem? Number 1 is pharma. Number 2 are the hospitals, the corporate hospitals. Number 3, government. So somewhere it's about I would say the intent and the incentives need to be aligned for all to have the right motivation to solve for problems in rural healthcare.
Yeah, I believe some of a part of this question was also discussed in the last group, where tier 2 cities were talked about. And yes, there are some pharma companies who managed to reach out there, who managed to do a fairly decent job there, but not as much as what is the required, need of the. Like you said, a day's wage is a day's wage for a daily, for a daily earner, and he really needs to choose between losing a day's pay and traveling all the way to try and meet a doctor, or to ignore some symptoms and then just say okay, I will look at it when the need really arises. So I think that's a big challenge, and if there is digital therapeutics and if it can solve it, again the entire nation would benefit with this kind of an initiative. I will circle back to Mr. Velmurugan. What are the possible barriers to patient engagement?
Plenty. I would say it's a lot. It's a lot, actually. More than barriers from the patient's perspective, I will again come back. It's the HCP, the doctor. Is the doctor willing to allow the patient to be part of any health therapeutic application? Because many doctors don't even want it. Because they are thinking that we are trying to influence them, and the patient will not be coming back to them, and why should I even get into it, especially if it is pharma driven. Okay, most of all this what we are talking about, I'm from commercial side, I'm part of the sales and marketing team. What is in it for us in the first place? We have to decide that this is, first of all, it's going to help the business overall, as well as we're going to take care of an important pain point from the perspective of adherence. For that, directly going to the patient is not a possibility. We are a prescription-driven business. It's very difficult. Dumb up probably is easy because people want to know about themselves, etc. But in this case, you need the doctor. So how will the doctor come into the picture? Doctor can come into the picture if the government pushes it, or there are policies which are around it. And if there are societies willing to take this up, we have a very good example within our organization, not in India, but elsewhere within the Servier world. So they have started this therapeutic application, and they've started working with the Cardiology Society, the Diabetes Society. They have really worked from the perspective of they really make a change for the community of that particular country. So if that was done, and then the push comes through the medical community. If that comes, then the success rates are very good. Success rate from the perspective of control for the patient, good reputation for the medical community, and also, of course, the patient here adherent, they're going to take the medications. It's also business for the pharma community. So it's a circle, It is important for us to understand that, for me, the biggest barrier is not the patient, it is the doctor. So that is very important. How to improve engagement once the doctor is on board. The next step, how do you engage a patient? Find tools. Use gamification, because now is the name of the game. You have all the lifestyle applications. You do so many steps, you get an award. You have many applications, even language applications like Duolingo give so many awards, You have gamification approach to make the people engaged. And another point, what Salil said in terms of acute management, even for chronic management, the caregiver has to be part of the program. In fact, the application which I was just explaining to you, they had a clear mandate that caregiver will also be part of the application, that they can nudge the patient. If the patient is not ready, the caregiver will not leave it. Case in point, I have 2 old parents. The father is affected by a condition. Mother doesn't know when to give the medication, but she is also old, So she always asks, can you give me a reminder, can you put something? So these kind of applications should think about it. So these things can improve engagement of patients. And of course, starting with the doctors, if the doctor is willing to do it, patients will come around and do it in India. Thanks.
So I think barriers exist at various levels. It's the HCP to start with, and probably the idea that, business is important, but it's probably the last rung of the ladder, the benefit.
For the doctors, I think why they don't come around, according to me, is that they don't see what is in it for them, Are they really seeing that? They're really making a difference. Of course, they think that they see the patient, they know what is the patient's condition, they can modify the treatment as and when they meet them. Can the data from the digital applications give more analytics to the doctors? AI, been spoken about since morning. how the doctor can even predict when the patient is going to be at risk, when the patient should be called back for the follow-up. These kind of things should be given to the HCPs. The HCP should see something really good in it, some value in it, then they will come around. So I think we need to connect everything. Otherwise, it will be good to have. Everybody has a lot of applications. Are we really driving? Is it going to make a change in terms of control, adherence? Can the disease be managed the way it is supposed to be? That's the question.
So value addition at every stage. I think that's the important takeaway, that you need to add value. Every application needs to add value for everybody who's going to be part of that. Great. So, okay, I will move on to the last set of questions. Vaishnavi has been looking at me repeatedly. I will start with Mr. Salil again. Looking ahead, what future innovations in digital health do you believe will have the most significant impact on managing widespread diseases?
Well, I think from widespread diseases, of course, there's a lot of work that is already being done, but I think there are very interesting use cases of where rare disease identification at a very, very early stage, using genomic mapping and all those advanced technologies using quantum computing, that's coming up in big time. That would be a real game changer if you're able to identify rare diseases even before they happen. Most of them are autoimmune or fetal, whatever. At any stage of life, if you're able to do that, that's going to be a real help. There is, again, this is not an innovation. I mean, it is an innovation, but it's not future. It's already here. And I think there are a couple of use cases that I can think of Indian companies, AI companies. So Niramai is one of the Indian companies that is trying to detect lung cancer before it happens. Roche has partnered with them, the big boys in cancer. So they are doing a lot of work with those guys to try to think about lung cancer. Astra's done one better, AstraZeneca. And they have tied up with a company called Cure AI, which looks at any X-ray. Any X-ray. I may have sprained my ankle and taken an X-ray. My wife would have had tennis elbow and she might have taken an X-ray. My child must have had a dental filling or braces or something. She must have taken an X-ray. They feed all that X-ray into their AI-based platform, and using algos, they are able to predict your chances of having cancers. Now, I don't know the tech, but AstraZeneca has tied up with these guys and currently with the government of Karnataka. And they've got, I think, about 60 million X-rays already on their database. And the whole concept is early detection. As quickly as possible, even before you know that there is any such case. If you know 5 years in advance that there could be a problem. Angelina Jolie, right? She made it very famous. So things like that, I think, are excellent innovations that have happened. Most of them are in the market. We are not really aware of what to do, or we don't know how to take it forward. Obviously, those guys are bootstrapped. They need collaborations with companies like ours. And so it's good that companies like Astra and AZ and Roche have actually collaborated. So I think that's some exciting work that's happening.
Great. Okay. My next question is going to be about data privacy, and it's to you, Anish. As digital health solutions gather sensitive patient data, what measures should pharma companies take to ensure that this data security and patient privacy are maintained while still making effective use of data?
I'll just make a slight modification and answer. I think this applies to everyone who's collecting data, not only pharma companies. Yeah. And it's important to have this policy to make the line between business and ethics black, not keep it gray. And I'll say what is required. The objective is to earn trust for whoever is collecting data, healthcare data specifically. And how do they go about doing it? I'll talk about right now, 2023, the Digital Personal Data Protection Act was out. Just a few days back, the rules have come out. And broadly, there are multifaceted things in the sense, the data principle, whoever is giving data, the patient, needs to give consent. They have certain rights because they are the data owners. And whoever is collecting the data fiduciary has certain responsibilities so that they do not misuse the data, exploit the data for exponential business at the cost of the data principal who is giving the data. Now, to do this, you follow the rules, you get certifications which are in the line of HIPAA, ISO 27001, 2022, even before this act and the rules were out. This is all certification. But the most important thing is these certifications ensure that you follow certain demonstrable processes and systems. You create them in your organization in terms of how you're handling the data so that you do not again exploit it. And the main point over here to earn this trust is one step definitely is to get the certification, but more importantly is executing what needs to be followed for every single transaction beyond the 2 audits which are required for the certification, but internally and externally for remaining 99% of the days when you're conducting your business operations as a data fiduciary. So if you're consistently demonstrating and following these processes and systems in handling of the data, you will inevitably signal trust over a long period of time. And if there are no adverse events in terms of how you're utilizing the data, misutilizing the data, you will earn that trust. So I think that is the entire process in the game. I think we have been collecting data since 1977, even before such acts were out in terms of the market research prescription business. And even then, there were certain processes today which was in a very rudimentary form, but which is there today also in ISO 27001 and 22 of aggregating data, masking, de-identifying patients, and so on. So that is the gist of it.
Got it. Okay. One last question, Mr. Velmurugan. How can digital health tools enhance medication adherence? It's something you talked about a few minutes back.
I spoke about it. So medication adherence, it's a very, very important topic. It's not an easy topic. Of course, to ensure that engagement of patient happens in a regular manner and the patient needs to interact, get that connection with the HCP. Adherence will improve, and when both parties come together, both the doctor and the patient, of course, if pharma can be of influence, it's great. So once that happens, adherence will improve, but get in gamification, ensure that you reward them, because this application which you're talking about, the tagline of this application is, it rewards for you to be in good control. You know, it pays to be in better health. So these kind of things that you be good, maintain your good health, you will get rewarded for this. So these kind of things will improve adherence. At the same time, all these things will work only if all work together. So otherwise, it's not, few people will be benefited. Some of them will do very well, but as a policy, if it doesn't happen, you will not have a mass impact in terms of adherence, because the ones who have done it effectively, they made significant changes in terms of the blood glucose control rate, blood pressure control rate, and the country themselves were very proud. You know, they were able to show this in their own government-related policies that what we have done is made a real impact for the population at large. Thank you.
So, any closing remarks from any of you three? Any one-liners that you want to leave the audience with?
For me, I think pharma professionals here, I think we have a very important responsibility to ensure that this adherence piece is not taken lightly. We do a lot of activities around, conducting, working with patients associations, or even conducting camps, etc. But this should not be for a short-term gain. It should be really thought of. I think as a strategy, I would say, for the marketing people, strategy is the buzzword. For organization, it is a buzzword. How it can be part of your strategy, how you can build adherence as part of a strategy. That's my last word. Thanks. And again, thanks. Sorry, I couldn't thank the Pharma State Academy. Thanks for giving this opportunity. A lot of learning. It's a brilliant session since morning. Really helpful for me as well, for a great learning. Thanks a lot. Thank you.
Thank you. Thank you so much. Over to you, Vaishnavi. Thank you. Thank you, ma'am. Thank you so much, dear panel members, for your wonderful insights. May I now request Mr. Girdhar Balwani to felicitate our guests